According to cancer.org, over 137,000 people are predicted to be diagnosed with colorectal cancer this year, and about 50,000 people are predicted to die of the disease. The specialist at Advanced Gastroenterology and Surgery Associates explained that early detection is key in fighting colorectal cancer because in most cases, cancer develops from precancerous polyps in the colon or rectum.
Colonoscopy screening is extremely important, and most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer.
For screening for a Caucasian population without knowing anything about the family history, it is recommended in the United States to be, first colonoscopy should be at 50 years of age. In African Americans, it is actually recommended to have first colonoscopy at the age of 45. Let's say that a first degree relative, so mom, dad, brother, sister, who have been diagnosed with colon cancer, then the relative will need a colonoscopy 5 years prior to the age of diagnosis of the person with the condition.
The actual procedure itself is relatively benign. Patients are sedated, either with moderate sedation or some even with general anesthesia. So the vast majority of patients don't recall the procedure or have any problems with it.
We've shared this with you before, but it's worth sharing again, this poetic reminder about the importance of colonoscopy screening.
I see the moon and the moon sees me. My moon now is over 50, unbelievably. If there's a polyp, trouble there could be. Better see the doctor of gastroenterology.
In both men and women, colorectal cancer is the third most commonly diagnosed cancer and the third leading cause of cancer death. For more information on colonoscopies as well as other treatments and surgical procedures available at AGSA, please click the Colon Cancer Screening story link on our homepage, yourhometownhealth.com.